Hey, this is Dr. Latoya Wells with another episode of Wellness Wednesday. I hope you all have had an amazing week thus far. And as we close out this Wellness Wednesday, I want to say thank you so much to all of you who have commented, who have liked, who have shared my posts recently. It just does me good to see that, and to see and feel the support from you guys is amazing. For those of you who don't know me, I am Dr. Latoya Wells, Doctor of Nursing Practice, family nurse practitioner, and owner of Wells Legacy Health and Wellness. And each and every Wednesday, well, most Wednesdays, there are some times where I will take a Wednesday or so off. However, for the most part, majority of the Wednesdays, you will find me right here on social media, in social media land, live, doing my Wellness Wednesdays. The goal and the purpose of Wellness Wednesday is to educate, to make you aware, and give you tips and tools that you can utilize to advocate for yourself and your health. With my practice, Wells Legacy Health and Wellness, we are a full service primary care practice located in Altamont Springs, Florida. We are accepting new patients. We are accepting some major insurances. So if you are looking for a primary care provider, if you and your family need to switch to a different provider, maybe yours closed, or there's a lot of physicians that are retiring right now. And so we are open. And so I encourage you to reach out to us, 321-306-6755. You can also check out our website at wellslegacyhealth.com, and you can schedule an appointment, see what services we offer, and all the things. Now that I've gotten that out of the way, I want to jump into tonight's topic. I know it's the 17th. We have 8 days till Christmas. And so if you are someone who celebrates the Christmas holiday, if you don't, if you celebrate Kwanzaa or Hanukkah or whatever your preferred holiday is, enjoy it. Enjoy your family, enjoy time with friends, enjoy yourself. And that's what it's all about, regardless of whether you celebrate one or the other or all. Enjoy. I just wanted to say that. Tonight, we want to talk about looking at the big picture when it comes to our health. We are winding down the year 2025. And I don't know about you, but 2025 has definitely been 2025. And I'm ready for a new year. I'm ready for something fresh, something new. And along with that is making sure that we're closing out things that we need to close out. I don't know about you, but typically around October, and I'm super behind, no judgment. However, I'm super behind on things that I would usually do, right? Usually in October, I start breaking down files and going through my file cabinet and filing things away, shredding things that need to be shredded, going through my bills and getting rid of all the stuff that I don't need any longer. However, I'm really behind on that. And even when it comes to decorating for Christmas, I was in the office earlier today. I had patients and had morning clinic, and I got some Christmas decor. And I'm just thinking to myself, like, oh my goodness, I am so behind. I feel so behind. Even with decorating, we just put our tree up last night. And help me understand. Last year when we took the tree down, I took the bulbs down, and I took all of the bulbs down with the little hooks. Answer me this, where are my hooks? Because 75% of my bulbs don't have hooks, let alone the little silver thing that holds the hooks. So I'm trying to remember if I had little people helping me last year with this tree, because yeah, something's not, the math is not mathing, as they say. But anyhow, I wanted to give into the pressure of not having all the things in place like I usually would have. And then I had to sit with myself and say, sis, you're in a different place than you were last year. And so, to all of my ladies out there, and men, to all of you, know that we can't compare ourselves in one season to a season that we experienced before, because we're completely different. Situations and circumstances are completely different. And so I had to give myself grace with when it came to that, because I was just like, ah. And I have a friend, I want to thank her, Angela, for encouraging me to, one, get this stuff out of the attic, and two, put the tree up. I'll send you your picture of my tree in a little bit. However, I wanted to come on tonight and talk about the big picture and things that we people are dealing with right now. So many people are feeling tired, stressed, and just feeling off. And want to know like what's really going on? What's really going on? And there are some conditions that I'm seeing in clinical practice that's lending to these feelings that these individuals are experiencing and feeling. And you guys know I've been talking about perimenopause because listen, your girl is me and Perry, we be yeah, we down like two flat tires right now. And hey, what can I say? What can I say? What can I say? But listen, it's so important that we understand the why behind what we're dealing with. I saw a patient earlier today, and uh, she just said, I feel heard and I feel like someone's listening to me. And that's what it's all about. And when I'm looking at patients that I've seen, when I've talked to people, even myself in general, I'm hearing these phrases so frequently. I'm exhausted. I can't focus. I'm gaining weight and I don't know why. And I just don't feel like myself. I don't feel like anyone's listening to me. And something is just off. And tonight we're going to talk about these symptoms and why they're so common, but they're not normal and they deserve attention. They deserve to be looked at. They deserve to have conversations about. These symptoms deserve attention. And I want to ask you a question. Who has felt tired, foggy, and off lately? Who's been told that your blood work, your labs are fine, but it still doesn't feel fine? As a healthcare provider and as a nurse, we were taught to look at the norms, right? If we see normal, then that's good. There's nothing wrong. But in my research and in my time and additional education and just kind of learning in terms of like holistic care and whole person care, just because a lab is fine doesn't mean that there's nothing wrong. There could be something very wrong and the blood work will still be normal. There's something called optimizing or optimization of these labs that we want to make sure that you're good, not just good, but in optimal health. And so some of the common things that contribute to some of these symptoms is high blood pressure, prediabetes or insulin resistance, thyroid issues or thyroid dysfunction, vitamin deficiencies, poor sleep or sleep apnea, and then chronic stress can all contribute to the feelings that I just mentioned earlier, feeling tired, feeling exhausted, can't think, can't concentrate, gaining weight, don't know why, just not feeling right. And understanding the backdrop of how these disease processes impact our bodies is so important. So when we look at high blood pressure is considered the silent killer. It's the silent one. It's the one that can creep up on people and before you know it, boom, they have a problem. And it's important that we pay attention to this, right? There is something called white coat syndrome. I've heard it, I've seen it. Individuals who typically have normal blood pressures or within range blood pressures that are not considered to be elevated or high. When they go into a healthcare setting, the blood pressure elevates, their heart rate elevates. Once they leave that setting, everything goes back down. Now, if your blood pressure is always elevated when you go to the doctor, something needs to be looked into because there is a high potential that this individual may have high blood pressure. And so nearly 50% of the United States, adults in the United States have high blood pressure. That's 1 in 4. 1 in 4. Only 1 out of 4 people have their blood pressure. Let me repeat that. Only 1 out of 4 people have their blood pressure under good control. That's scary because if we knew the impact of high blood pressure, if we understood the implications and the damage that it can do to our health, we would be booking that appointment tomorrow with our primary care provider. And many people don't have any symptoms at all of high blood pressure, like none at all, until it's to a point where it's caused some damage. Normal versus elevated values when we look at the blood pressure. So normal blood pressure is less than or equal to 120 over 80, less than 120 over 80. Elevated is considered anything 120 to 129 and greater than 80. Hypertension is considered anything greater than or equal to 130 over 80. Let me repeat that because I think I just got that wrong. Normal is when we look at blood pressures, that's between 120 over 80. That's considered to be normal. And then there's some guidelines that have gone back and forth that the normal ranges were elevated to 130 over 90. Elevated blood pressures, anything greater than 120 to 129 and on the top number, and anything greater than 80 on the bottom. Hypertension is anything greater than or equal to 130 over 80. So if you have a blood pressure, essentially what am I saying? If you have a blood pressure that is greater than 130 over 90, that is considered to be hypertension. As a healthcare provider, I still like to go by the old numbers of the 120 over 80 as my baseline. However, there's some wiggle room with that. So if somebody is usually at 120 over 80 and their numbers are slowly increasing and we surpass that 130 over 90, 130 over 80, then we know that this individual has high blood pressure. And one of the things I want you to know is that we won't diagnose high blood pressure with one reading. It has to be several readings over different days, different times of the day. All right. But if you know that your blood pressure has been high for years and you go to a new healthcare provider, be honest about that. Have those conversations about that, because if you're coming to me as a new patient, I got to get to know you. I got to get to understand what's going on within your medical history and your past medical history and what you're dealing with in the current. And if you're not honest with us, or if you're not forthcoming with that information, then it'll be hard for us to really develop the correct plan of care for you. So why does it matter that we pay attention and control blood pressure? High blood pressure can cause fatigue, which is that tired feeling. It can cause headaches. It can cause poor sleep, brain fog, increased risk of stroke, heart attack, and kidney disease, and heart disease. Heart attack is considered to be heart disease. Most people often say, I didn't know, I felt fine. That's why it's called the silent killer. Individuals don't know, they feel fine. They don't think there's anything wrong, when essentially there is, and it's just hasn't shown its ugly face yet. Next thing I want to talk about is prediabetes and blood sugar imbalance. We are seeing a lot of people with prediabetes and diabetes right now. And before the continuous glucose monitoring device, the CMVs, I think that's what they call it. The little discs that you see people wearing on their arms, those used to be far and few between, right? Few and far between. I think that's how you say that. However, we're seeing it more so than ever. And it's not just for diabetes. It could be for other reasons as well, insulin resistance or what have you. However, I'm noticing more people with the continuous glucose monitors than I have ever seen out in public when I'm shopping and just out and about. 96 million adults in the United States have prediabetes, and 80% of them don't know. Diabetes is one of the leading causes of fatigue and brain fog. One of the leading causes of fatigue and brain fog. And so, I've been talking to my ladies dealing with perimenopause and menopause. We talk about the brain fog a lot. When you go for your physical exam, that provider should run a set panel of blood work. And in there should be some blood work that's testing you for diabetes or prediabetes. So when we're looking at the numbers, a fasting glucose normal is 70 to 99. Pre-diabetes, if you're fasting and you go get blood work and your glucose is between 100 and 125, that's considered to be pre-diabetes. Anything that's greater than 126 is considered a diagnosis of diabetes. However, we will have to do an A1C, hemoglobin A1C, which is a 3-month look back at your blood sugars, and it's a calculation that is that's the gold standard for diagnosing diabetes. When we're looking at hemoglobin A1C, normal is anything less than 5.7. Pre-diabetes is 5.7 to 6.4. Once you cross that threshold and you're greater than or equal to 6.5, you have a diagnosis of diabetes. And lately I heard someone, and it wasn't in relation to diabetes, but my response was, yeah, that's just like having a little bit of this. And so I hear all the time, oh, I got just a little bit of diabetes. No, you're either pre-diabetic or you have diabetes. And there's no such as a little. Oh, I just got a touch of hypertension. No, it's either elevated or it's not. So what are some symptoms that people ignore that will lend to a diagnosis of diabetes? Energy crashes, you're doing fine, and then all of a sudden your energy plummets. Sugar cravings, weight gain, especially in the midsection, frequent urination, difficulty concentrating. People think they're just tired when their blood sugar is on a roller coaster. I can tell when my blood sugar is I don't have diabetes, but I can tell if I forget to eat, if I'm busy and I just forget to eat. Listen, before I started this, I grabbed my banana because I've been going. I did eat earlier, but my body was talking to me and I needed to grab something. So before I started this recording, I grabbed my banana and I was like, let me just take a few bites because I felt the foggy. I felt I wasn't clear in my head. But as soon as I ate the banana and I drank some water, I felt better. And I was more, able to concentrate. So the next thing that we look at when someone is complaining of being tired and just lethargic and not feeling well is their thyroid. How well is the thyroid functioning? And you guys know I love my statistics. About 20 million Americans have thyroid disease. Up to 60% are undiagnosed. And women are affected by thyroid disease, whether it's hypothyroidism or hypothyroidism, 5 to 8 times more than men. 5 to 8 times more than men. When you're getting your blood work done every year, every 6 months, how often your provider is having your blood work ordered, you should have a thyroid lab there for your initial lab. Not saying that they're going to do it in additional times that you get blood work done throughout the year. And that's going to depend on what you're dealing with. However, a thyroid panel should be included in your blood work at least once a year, just to kind of monitor and keep track of what's going on. So what are some of the common symptoms of thyroid disease? Fatigue, weight gain, weight loss, depending on if it's hypo or hyper, heat or cold intolerance, thinning hair, depression, brain fog. We've talked about hypertension. We've talked about pre-diabetes and diabetes, and we've talked about thyroid disorder. And all three of them have fatigue, weight gaining, brain fog. The thyroid touches nearly every system in your body. Your thyroid releases a hormone. It's called the TSH, or the thyroid stimulating hormone. And that hormone impacts just about every organ system. And when it's off, everything else is off as well. I can remember my mom developing hyperthyroidism. And within a short period of time, her health changed drastically. She lost a lot of weight. She began to have the thyroid eye, meaning like almost bulging eye. If you can remember Barney Fife from, oh gosh, what was the name of the show? It was the sheriff guy and I forget. Listen, I'm having a brain fog moment at the moment. But Barney Fife, look up Barney Fife. There was a police show that was on TV when I was younger, when I was a little girl. And the deputy, one of the policemen, his name was Barney. And his eyes were just like bulging. And he had all this energy. He was very skinny. very thin, he had hyperthyroidism. And so my mom began to have these symptoms really quick and fast. And she ended up having to have her thyroid removed. So she was in hyperthyroidism. Once the thyroid was removed, she's now dealing with hypothyroidism because she doesn't have the thyroid there anymore to secrete those hormones. So she has to take synthetic thyroid medication to replace those hormones because your thyroid is an essential organ that we need in our bodies. Vitamin deficiencies, often overlooked, but very important. 42% of adults in the United States have a vitamin D deficiency. And I can remember when we really started focusing on vitamin D. Many people were like, oh, well, I go outside, I'm in the sun. Yeah, majority of people are vitamin D deficient. There's some controversy over, do we need to treat it? How much do we need to treat? And the lasting implications of low vitamin D levels. I can say for me, when I found that my vitamin D levels were low and we treated it, night and day difference. B12 deficiency is also common in individuals who are older, those who are vegetarian, and people who are on acid reducing medication, as well as individuals who have had gastric surgery, gastric bypass, any type of surgery that they've had to help with weight loss. So those individuals have to take vitamins for the rest of their life, essentially. So what are some normal ranges? So a normal or optimal, I'm going to put it like this. An optimal range for vitamin D is greater than or equal to 30 up to 50 plus on the lab values. B12, 200 to 900. Symptoms can appear even in low normal levels. So many people will go out and just start taking vitamins without having blood work done. And as long as you talk to your primary care provider or your provider about that, then it's okay. But always be sure that you're having those conversations on what to do. Fatigue, some of the symptoms of low B12 is fatigue, tingling and numbness, mood changes, memory issues, weakness. Low vitamin levels can look like depression, can look like anxiety, and can look like burnout. And it can be treated with a supplement, right? It's amazing. Next thing is sleep disorders and poor quality sleep. 1 in 3 adults don't get enough sleep. You know, we should be having 6 to 8 hours, getting 6 to 8 hours of sleep each night, right? To be able to replenish our bodies and all the good things. Raise your hand if you're getting 6 to 8 hours a night. Sometimes. What are the implications of sleep apnea and how prevalent is that? Up to 80% of individuals with sleep apnea go undiagnosed. Like if you're snoring at night and you're not breathing in between those snores, you have sleep apnea. There is something going on. There is an obstruction and it's not good. So we have to make sure that we're screening individuals and we're asking the appropriate questions as healthcare providers. So what are the implications and what happens with poor sleep? It increases the blood pressure. It worsens blood sugar control, increase in inflammation, impacts mood and memory, and makes weight loss harder. Sleep is not optional. It's foundational. Like we have to sleep. And I can remember when I used to work night shift, then I couldn't sleep during the day. I had a hard time. So I had to really adjust and figure out how to get sleep and make sure that I'm resting properly. And then one thing that I want to talk about is chronic stress. This is the amplifier. Stress alone may not cause disease, but it worsens everything. It worsens the blood pressure, the blood sugar, weight, immune function, mental health. Stress does not live in your mind. It lives in your bodies. I can't tell you how many times I go for my massage and my massage therapist is working on my shoulders and my neck to get the knots out because I tend to carry my stress in my shoulder and my neck area. What I want people to do now Know your numbers, know your blood pressure, know your baseline A1C, know your cholesterol. Key labs when appropriate. These labs should be done on a minimum once a year and include several specific blood tests. And if you want to know what tests I typically order for my patients, drop the word labs in the LABS in the chat, in the message, and I will send you a list so that way you can ask your healthcare provider when you go, can you order these labs for me? Or when you go to get blood work done and you're able to look at the orders that were given to ensure that all of the ones that you should be getting are on that list. And to be able to partner with your healthcare provider to ensure that now you can't go in there asking, you can go in there and ask for whatever you want. However, if you have insurance, there's some parameters in place. So I'm going to put that caveat out there, right? Because, it's just a lot. Like, I've had people come in and ask for off the wall labs, and it had nothing to do with what they were going on or any history that they had. And so I tell them, I can write for it. I can't promise you that the insurance is going to pay for it. The next thing is tracking your symptoms, tracking headaches, tracking your mood, tracking your fatigue levels, tracking sleep quality. It's important so that when you go to your provider's office, you can say, out of the last 2 weeks, 8 of those days, I didn't only slept a couple hours. Or in the last 2 weeks, my blood pressure has been elevated, and then give them the numbers. So tracking your symptoms, tracking what's going on with you. And then how do you prepare for your appointments? I encourage you to ask, what could be causing this? If something's elevated or wrong, off, and, abnormal, ask what could be causing that. And are there labs that we should check? I have a friend who, her husband had some blood work done, and she said that she doesn't normally go with him to his appointments, but she went this time. And when she looked at the blood work, there was one specific lab that was off. And her being a healthcare provider, a physician, her being a provider, she was able to notice that that lab was off. And it turns out that her husband had cancer. And the provider was like, oh, it's normal. Well, that individual knew. So knowing your labs, knowing the numbers, knowing the baseline will be helpful. And asking the question, are there any labs that we should check? Are there any screenings or tests that I need to do to rule out such and such? And what can I do before this gets worse? So if you are pre-diabetic, one thing I do is I take time and I spend time educating my patients and providing them with alternatives to medication early on, because some of them may not want medication. Some situations we have to go on medication, but I'm willing to talk with them and to kind of develop a plan of care that fits their needs versus also includes the clinical aspect of it as well. Address the basics: sleep, making sure you're staying hydrated, making sure you're moving. As you all know, 30 minutes, 5 days a week for a total of 150 minutes of moderate intensity exercise each week. Nutrition, all things in moderation. Now, if your cholesterol is elevated, your blood pressure is elevated, we may need to tweak some things like decreasing the sodium and decreasing the amount of times that you're eating fried foods and things of that nature. And then working on stress reduction. Stress reduction is so important, and especially as we are around the holidays. The holidays can be stressful in and of itself. I want to leave you with this. We shouldn't be stressed out over times that supposed to bring us so much joy. Feeling tired, foggy, off is common, but it's not something that you should ignore. Your body gives whispers long enough before it screams. And you want to answer those whispers before your body starts screaming, because typically when it starts that process, something is wrong and really wrong. Primary care is about listening early, partnering wisely with our patients, and protecting your future health. It's so important that we partner together to make sure that you are getting everything that you need, you and your healthcare provider. And again, I'm going to throw this shameless plug. If you don't have a primary care provider, we are accepting new patients. So I want to know if this resonated with you. Type check in the chat. Share this with someone who keeps saying, I'm just tired, or someone that you feel needs to know or to hear this information. And if you're looking for a provider who will partner with you, we're here to help you. Again, this has been Dr. Latoya Wells with Wells Legacy Health and Wellness for another episode of Wellness Wednesday. Stay safe and be well. We'll talk to you soon. Bye.